To use Brinzolamide 1% eye drops, follow your doctor's instructions, usually applying 1 drop in the affected eyes 3 times a day. Before using the drops, make sure to wash your hands. Avoid touching the dropper tip to prevent contamination. If you wear contact lenses, remove them before using the eye drops and wait at least 15 minutes after each dose before putting your lenses back in. Tilt your head back, look upward, and pull down the lower eyelid to create a small pocket. Then, place 1 drop into the pouch and gently close your eyes for 1 to 2 minutes, applying gentle pressure at the corner of your eye near the nose. After using the drops, do not rinse the dropper and replace the dropper cap. If you use other eye medications, wait at least 10 minutes before applying them and always use the eye drops before eye ointments. It's important to use this medication regularly at the same times each day to get the most benefit from it. Even if you start to feel well, continue using Brinzolamide as prescribed, as most people with glaucoma or high eye pressure do not feel sick. When using Brinzolamide 1% eye drops, you may experience temporary blurred vision, a bitter/sour/unusual taste in your mouth, dry eyes, temporary discomfort/itching/redness of the eye, feeling as if something is in your eye discharge, and headache. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, if you do experience any serious side effects, such as nausea or vomiting that doesn't stop, eye or eyelid swelling/pain, stomach/side/back pain, yellowing eyes/skin, dark urine, easy bruising or bleeding, unusual tiredness, or signs of infection, such as a persistent sore throat, fever, or chills, it's important to contact your doctor right away. While a very serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed, it's important to contact your doctor or pharmacist. When using Brinzolamide, it's important to let your doctor or pharmacist know if you have any allergies, as this product may contain ingredients that could cause allergic reactions. Be sure to discuss your medical history, especially if you have other eye conditions, kidney problems, or liver disease. If you experience an eye infection or injury, or if you have eye surgery, you should check with your doctor about whether you should continue using your current bottle of Brinzolamide. Your doctor may advise you to start using a new bottle. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you use, including prescription drugs, non-prescription drugs, and herbal products. After applying this medication, your vision may become temporarily blurred or unstable. Avoid driving, using machinery, or engaging in activities that require clear vision until it is safe to do so. If you are pregnant, this medication should only be used when clearly needed. It is also unclear whether this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Brinzolamide 1% eye drops include high doses of aspirin or related salicylates, such as those used for arthritis. However, low-dose aspirin prescribed by your doctor for specific medical reasons, like heart attack or stroke prevention, should be continued. Be sure to consult your doctor or pharmacist for more details about any potential interactions. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can reach out to a provincial poison control center for assistance. It's important not to share this medication with others. You may need to undergo lab and/or medical tests, such as eye exams, while using this medication. It's important to keep all medical and lab appointments. Make sure to consult your doctor for more details. If you forget to use a dose, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use the next one at your regular time. Don't use a double dose to make up for the missed one. You can store Brinzolamide 1% eye drops, suspension ophthalmic antiglaucoma agents at room temperature or in the refrigerator. Make sure to keep all medications away from children and pets. When it is expired or no longer needed, properly discard this product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.